And then I want to talk a little bit about dealing with pain as a golfer. Okay, so number one thing, when anybody comes to me with pain, I need to assess them. I want to rule out any major injury, major issues that may require further investigation or further testing. Once that's done, we want to start to do things to kind of ease the pain and maybe restore movement in the painful area as well as globally. If they can still swing and practice to a degree, we may have to lower the volume and we have to stop for a short period of time, but the goal is to get back to that as soon as possible. We may do that. And then we want to start to load the painful area. So if it's a back, if it's elbow, whatever it is, we want to start with some isometric loading where we're just holding against the resistance, not moving. We want to start maybe some eccentric loading where we're controlling that lowering portion. So, if it's these, we're controlling that down, and we may help back up, and we may pull back up on our own. And then we want to progress that into full concentric, full range of motion, progressing that load through the full movement. With that, we want to keep you training. So if you're not training, we want to start you training around the area. If you are training, we want to keep you training as much as we can, modifying and avoiding only as we need. And then if we had to stop swinging or we want to ramp that up, we want to return to a graded return to practice and play. And we may need to address some swing mechanics with that. The reality is there may be some mechanical things in your swing that are contributing to your pain that need to be looked at as you return to play. So assess, rule out any major issues, restore movement and decrease pain, continue training. Well, if you're not training, start training. And then start to load the painful area, isometrically, then eccentrically, then full range of motion, progressing that load, and then a graded return to practice and play, addressing mechanics as needed with that.